Hey guys, Ashley with Amare. So, few resources for you guys. We are located in Elizabeth and Highland Park, New Jersey, and I also offer virtual consults. So, if you guys need my help, give the office a call, 732-841-0142, and our scheduling coordinator can help you get set up with an appointment. We also have our online shop. So, all the products that I talk about in my videos, those are all in our online shop for you guys to purchase. On our Instagram, Amare Healing Arts is our Instagram. All the products are linked right there in our bio. Also, the online shop is linked, and it's linked in the description box for each video. So you guys can go and check those out. And then we have our online course school, the Post-Op Academy. So all of the things that you would need to know post-op, we are doing online courses for. So things like what kind of massages you need, when you need to get them, who to get them from, how to find a therapist like me, all of that we have online courses for. There are going to be more courses coming out all the time. So check in on that to see what's new and what you guys can learn. If you like my videos, all of those courses are exclusive content. All those videos are exclusive content. None of them are on YouTube. They're all in our courses. So that is amarehealingarts.teachable.com. The link for that is also in the description box, and it is also linked in our bio on Instagram. So I hope you guys enjoy the content. Ashley with Amare. I will see you soon. Bye.
Hey guys, Ashley with Amare. So today we are going to talk about when should you start your massages after liposuction. So this is specifically geared towards liposuction, this video. I get this question a lot, like, when should I start? Is too late? Like, 2 months or 2 weeks? Like, what's the time frame? Okay, so first let's understand what liposuction is. I have a lot of videos talking about lipo. Liposuction can be something as big as 360, which is all the way around your body, or just in one small area, just to target the love handles and the lower abdomen. So liposuction is a very broad thing. It can be done thighs, arms, body, no matter where you're getting liposuction, it's the same thing because the healing process is the same. Now, what makes this different is that yes, the healing process is the same, but some areas are going to take a little bit longer to heal than others. Areas that are moving around a lot, like your arms or your thighs, you may start seeing swelling more in those areas than you would your abdomen. On the contrary, which is where the caveat comes in, the opposite, because your lymphatic system, the thing that's responsible for getting rid of the swelling and healing your body, requires skin movement in order to get that swelling reabsorbed so you can pee it out. So things that were moving more, like your arms and your legs, if we have proper compression and proper lipofoams, they're going to be getting more lymphatic stimulation, which means they're going to be absorbing more swelling than an area that's more stagnant and less mobile, like your abdomen, your sides, and your back. Which is why when we get lipo 360 or lipo to the abdomen, the back, the sides, it takes a little bit longer to see, I don't want to say the complications, but to see like the swelling and the fibrosis and what's really under there, because we're not paying attention to it as much, right? We're in a garment, we're stagnant, we're not moving. We're not really, like, it's not visible as much to us, whereas the arms are and the legs are. So that's my little caveat before we start this. But I have an article as usual, and we're going to start with this. So plasticsurgery.org, news/article, 8 ways to make liposuction recovery a breeze at home. So again, the topic of this video is, when do I start? And everybody wants to know immediately. You can, doesn't mean you should, you can start 48 hours after your liposuction. Again, disclaimer, manual lymphatic drainage, the massage you need after liposuction, does not involve fluid leaving your body. My most recent video is that we just posted is about how New Jersey is starting to crack down on that, thank God, something that I've been working towards and educating the Board of Massage on for a while. Incisional drainage, pushing fluid out of incision sites, ever after any surgery, is not legal for massage therapists to do. That is not massage, that is incisional drainage or aspiration, and needs to only be done by a medical professional. So when we talk about manual lymphatic drainage, I'm talking about this gentle skin stretching motion That's it. I'm not pushing in. I'm not raking or pressing or rubbing or anything deep. You guys just had surgery. Even if you are 6 weeks out, even if you are 3 months out, that tissue is still fragile. We are not doing any of the rubbings, okay? No rubbings of the tissue. No machines, no rollers, no pressure, no oil, nothing. Your lymphatic system is designed, like I said, for the skin to be moved. That's it. So put your hand on your chest, right where your sternum is or your collarbone, and just move the skin over your bone. That's what manual lymphatic drainage should feel like, especially after surgery when you're sore. That skin movement is what dilates the lymph vessels to get your body to reabsorb the swelling so you pee it out. Otherwise, the swelling is just going to sit in between your skin and your tissue where the lipo was done, which we're going to talk about in a second. So getting into this, again, you can start 48 hours after surgery. If you can, get to our office, get up yourself, and get to your session. I never recommend having anyone come in to do your lymphatic massages. First of all, it's not sterile. You may have pets, you may have kids, things like that. We don't want to be doing any of that. Second of all, you need to be able to move. You need to be able to be comfortable enough for your body to process the swelling and the fluid. If you are too fresh, and this comes with the 4 stages of wound healing, the first stage is homeostasis, which is where your body is trying to stop the damage in the area, right? So you just got cut. Liposuction is an internal cut. We're internally cutting the entirety of your tissue and your fat. So just because you can't see it and all you see is the incision holes doesn't mean that the inside isn't damaged. All that tissue is needing to repair itself. So within the first day 1 to day 5, we're doing the bleeding, the trauma work, the healing, and all of that, right? So homeostasis, your body is trying to stop the damage and contain it. Then we get into the inflammation phase, which is like day 4 to 21. That's where the swelling comes in. So a lot of you guys are so ready to start your lymphatic drainage massages immediately after surgery because you're terrified of not healing properly. You can wait. The swelling isn't going anywhere. It is more important that your body is healed enough for you to function without causing more damage than you trying to rush to get in to get a massage. I would rather you wait until you're coherent, you can get to the office, you can move around on your own before you start getting your massages, because the purpose of your massages, is to get the swelling back into your body and close that space between the tissue and your new baseline of tissue, the skin and your new baseline of tissue. That space where all that tissue was sucked out, all that fat was sucked out, is full of swelling. And if we leave that swelling there, it's going to keep that skin stretched. It's going to stop your healing. It's going to increase diffusion distance, which is the distance that it takes for nutrients and blood to get to your tissue and your skin. It's going to start forming fibrosis, which is where the proteins that are in that swelling, the point of the inflammation phase is to bring in proteins, myofibrins, collagen, elastin, all of the proteins that make tissue. It's going to fill in that space because, like I say all the time, your body doesn't know it wasn't attacked by a bear. It's going to try to heal itself in whatever way it knows how. And the way that it knows how is by bringing in proteins and making new tissue. It doesn't know we did the lipo on purpose. So we want to make sure that we're keeping that space empty and decreasing and decongesting, because manual lymphatic drainage is decongestive therapy. We want to decongest that space so the skin heals nice and flat without any excess proteins, because those excess proteins cause fibrosis. I do have an entire fibrosis course coming out soon. So we're going to get into that, as far as how fibrosis is made, where it comes from, how to stop it from forming, how to reverse it after it's formed. All of that is coming up soon. The link is in the bio to our post-op academy where all of our online courses are. So we'll let you guys know when that's out. But the point of your lymphatic drainage massages is to get that swelling out so that you heal soft and flat and natural, so that the skin retracts really nicely, so that we don't have any protein buildup causing fibrosis. So that swelling has to be in there to heal the tissue a little bit, but we don't want excess. That's where the problem comes in. That's when fibrosis starts. That's when all our results start looking a little wonky, lumpy, bumpy, all the craziness, right? So again, one more time, the point of your manual lymphatic drainage massages after lipo is to get all of that swelling out so it doesn't cause problems with your healing. So let's get into this article. Liposuction comes in many forms. While liposuction in and of itself seems straightforward enough, simply sucking the fat out of the body, there are plenty of options to combine traditional liposuction with modern energy devices for a more sculpted result. Vaser, right? Using ultrasound, things like that. The types of liposuction you have will determine your healing. Sorry, guys. The type of liposuction you have will determine your healing, explains Dr. Neinstein. If you guys know anything about plastic surgery, Dr. Neinstein's amazing. Who adds that liposuction has evolved from an exclusive fat removal operation to a body sculpting procedure with the popular pairing of the surgery with popular energy devices like Vaser. It's the key device for surgeons who primarily focus on body sculpting or liposuction, meaning Vaser, right, around the world. Vaser is an ultrasound-based device that uses gentle energy to melt stubborn fat so it comes out smoother and easier and in large amounts. This gentler way paves the road for less bruised, less swollen recovery than you would find in traditional liposuction alone. Notice how they say less. That doesn't mean you're not going to have bruising and swelling. It just means that it's going to be less. Further, the scope of your liposuction, whether you address one or two trouble areas, like I said, or had an all-over procedure, will impact the length and breadth of your recovery. So, again, let's talk about this. When do we start? We start as soon as we are comfortable coming in. Now, let's say, you only had, like they said, a minimal area. Let's say you just had your arms done and you're up and you're moving and you're good like 48 hours after. Or let's say you just had like a little bit of sculpting on the bottom to get rid of the lower abdomen pouch and the flanks. That's it. That's all you had. You had a little bit of sculpting done. You can come in 48 hours if you can come in. So starting earlier, yes, is better because it jumpstarts your recovery. You're out of the garment quicker, you're healing quicker, you're moving quicker, you're back to work. There's less complications. So it is better. But if it is an overall procedure, lipo 360 all the way around, if you're still on painkillers, this is my number one thing and the number one key to when you can come in and when you should come in, right? When you should start your gentle manual lymphatic drainage. All other kinds of massage should be held off until your 3-month mark. So cavitation, wood therapy, cupping, all of that stuff, none of that is designed specifically for swelling, healing, and protein removal from the body, right? So all of those things should be done. Those are all like body contouring, sculpting, massages. All of that stuff should be done 3 to 6 months, not within the first 3 months. Now, if you are 3 months out and you still have fibrosis and you still have swelling, you should still wait to do those things until you do manual lymphatic drainage first. So the order of operations for what massage you need when and when to start, okay? Manual lymphatic drainage if you are swollen and fibrotic. Once you are healed, everything else. So the body contouring, the wood therapy, the ultrasound cavitation, the radio frequency, cupping, all of that, once you have no more swelling and fibrosis, because all of those massages are a little bit more aggressive, a little bit more invasive, a little bit more deep. And if there is tissue still trying to heal and you do have fibrosis and swelling, it's going to aggravate the fibrosis and swelling you already have. So the first kind of massage you need that you should be doing, and again, starting 48 hours if you are not on painkillers and you can get up and move around, or when you're off the painkillers and you can get up and move around and comfortably come into the office, then we can start. That should be manual lymphatic drainage, gentle, hands-on. So the reason I say that is because this next section says lymphatic massages are essential. The first week, the body is quite inflamed. Inflammation, proteins, fibrosis, swelling, which translates to you feeling sore, a little tired, and the body has either retained a lot of fluid or has made a lot of fluid. And our main focus is getting all the excess fluid out of the body, says Dr. Neinstein, who adds that this is done via drains or a combination of drains and lymphatic massage, a low pressure technique to stimulate the body's natural drainage process. Did you hear that? Manual lymphatic drainage, lymphatic massage is a low pressure. If someone is pushing into your body or rubbing or doing any of that, Dr. Neinstein is telling you that's not what your lymphatic massages should be after lipo. They should be the gentle, low pressure technique, especially in those first 6 to 8 weeks, because again, the goal is to get that excess fluid off of you, right? So any tumescence fluid that's left in the body, usually after lipo, if you've had, it varies from surgeon to surgeon, it varies from human to human body that we're working on, but if you've had like 3 to 5 liters, you may have an actual JP drain after your lipo. If you don't, your incisions may stay open for your body to naturally aspirate that fluid. That should stop within the first week. The point of that tumescence fluid, which I have a whole video, if you just type into YouTube Amare tumescence fluid, you'll find it, where I explain what the tumescence fluid is made up of. I whip out the plastic surgery textbook. I go over the whole thing. But the quick and dirty on that, tumescence fluid is epinephrine to help blood vessel constriction, as well as lidocaine, a little bit of painkiller. And the point of the tumescence fluid is to open the space and fill it up between your tissue, your fat cells, and your skin. So it's easier for the surgeons to go in there and extract the fat. So tumescence fluid is used with every kind of liposuction. It's one of, the things that everyone does. And your body, that's supposed to stay in there again, because that painkiller part, we're not pushing that out of your body, because that's not going to help your swelling. That's in there still. Whatever your body is not aspirating through the drain or the incision, that's in there still because your body needs it. So we want to get your body to absorb it to help with the pain, right? So that would be the absorptive properties of manual lymphatic drainage, not expressing it out through incision sites, which is not legal anyway. So again, the point of this is to help that fluid come down. The point of your massages after lipo is to help with fluid and swelling reduction. And that should be the low pressure technique to stimulate the body's natural drainage absorptive properties, lymphatic drainage massage. While every plastic surgeon will have their own list of recovery do's and don'ts, many have their liposuction patients begin lymphatic massage the day after surgery and continue the appointments several times each week for 2 months. In addition to releasing fluid, it also helps prevent fibrosis, contour irregularities, lumps, and bumps. As Christian Subio, MD, a plastic surgeon, and ASPS, American Society of Plastic Surgery in Philadelphia. If you guys don't know Dr. Subio, you haven't done any Instagram research, because Dr. Subio is amazing. I've met with him. I've met with his entire staff in Philadelphia. I drove out there, educated them on lymphatic massage. He is amazing. And again, as he's telling you, it helps to prevent fibrosis. Fibrosis is a protein buildup. Those proteins are housed in your lymphatic fluid. That lymphatic fluid is swelling. The reason that's there is to help repair tissue. Again, prevent fibrosis, contour irregularities, lumps, and bumps. Massages help facilitate the drainage of the lymphatics and make results more even and smooth. Guys, again, your lymphatic massages are meant to absorb that swelling and those proteins to prevent fibrosis. That is the key. Now, again, they say you can start 48 hours after, but I'm telling you, if you can't place your hand on your skin and move your skin without it being painful, like where your lipo area was. Like the first time you go to shower, I encourage you to do this. This is a good check. So how to know when you're ready to come in for your manual lymphatic drainage massages. When you take off your garment and you go to shower, just place your hand, let's say it's arm lipo, on your skin, and gently move your hand back and forth. That's it. We're not pressing, we're not rubbing, we're not digging, we're not squishing. Just drop your hand on your skin and gently move it like this. That's it. If that for you is too much and sends your nerves on fire and you're like, oh my God, I'm seeing stars, this is so painful, I can't do this, then you need to wait to come in for your manual lymphatic drainage sessions, because that is the pressure. That is the gentle pressure they're talking about. We're just placing the hand on the skin and moving the skin. That's it. If that is too much, you need to wait a little bit. So do that check every day and see when you're ready to come in. Now, flip side of that, if you go to get a lymphatic massage and it is extremely painful, it is not real manual lymphatic drainage. It is not the real thing, because again, any CLT, MLDC certified manual lymphatic drainage therapist knows how the anatomy works. We all have this fancy little map that we learn and memorize as to how your system drains and how we need to work to get the fluid to reabsorb into your body from your surgery area. So if that pressure is deep, or painful and your skin is not just being moved, but you're feeling it in your body, that's not the real thing. And if you need help finding a therapist, or the best thing, because not all massage therapists that do manual lymphatic drainage are going to be listed on therapist directories. Now, if they went to a school that certifies in manual lymphatic drainage, like Acoles, Norton, Close, any of the ones that I have certifications from, they're going to have a directory list of all the therapists and the states and what they're certified, like their credential level, showing that they're certified in it. That does not mean that they're practicing the correct technique, though. So the most valuable thing I have for you is the PDF guide, which you can also purchase at the postopacademy.com website. The questions that are on there to vet your therapist are extremely important, because there have been multiple times where I've been in a virtual with someone, the credentials check out, they're on the therapy directory list for an accredited school, and they're using CBD oil to do lymphatic massage and rubbing over the skin. That's not manual lymphatic drainage, and that's not what we were trained to do. So those questions on there for vetting your therapist are super important, because that's a checklist of questions with answers that they should be giving you something in line with that answer, so that you know, okay, they know what they're talking about. Like, they understand the anatomy the way that Ashley does. Like, they get it. They're good. So making sure that you're finding someone that's actually doing this appropriately is key. If you also need more help than the PDF with that, get the PDF first. But if you need even more help than that, or you can't seem to find anybody in your area, schedule a virtual with me, because we got a lot of options for you guys. But again, that's when you kind of know you're ready to come in. Now, I say this all the time, guys. Good news is the swelling's not going anywhere. That inflammation phase, that second phase of wound healing, is creating a container for your body to heal in. The problem is when the swelling starts to stretch the skin and put pressure on the tissue and inflates and then stagnates and causes that fibrosis, causes the irregularities, causes the lumps and bumps, causes seromas, all of that stuff. All of that is because the swelling is trapped. So this gets the swelling moving. But as they said, you want to be coming in several times a week. Now, here's the thing. To start, right, we want to see you like once or twice a week. As your body starts to decongest and your swelling starts to come down, you will be less sensitive. Then we can do more frequent sessions. That's the way we work. Because that first week you come in, depending on where you are in your healing time. This is why how many massages do I need is never a straight answer. Because it depends on where you are with your healing and where your body's at with its congestion level of swelling. So if you can tolerate being touched that much, and you come in to see me and you're a month post-op and that sensitivity isn't there, but we've got a lot of fibrosis that's built up, lumps, bumps, irregularities, and we've got a lot of swelling still, and we're still in that first garment and we're not making any progress, and it's just congealing and thickening and getting hard, we're going to want you to come in a little bit more frequently. We're probably going to start you with consecutive days back to back, like as soon as we can. Or flip side, if you are coming in 48 hours after, we may only do twice a week, give you a little bit more time to heal, to get further into that healing timeline, that phase of wound healing timeline, so that you can tolerate all that swelling coming out. Now, here's one more thing, because I get this all the time. I just want to get all the swelling off of me. Guys, you need the swelling. It's got proteins you need to heal. The problem is the excess. Contrary to incisional drainage, which is not real, or no, I shouldn't say not real, because it is real, but it's not a good thing to be doing after liposuction, like physically, for your body and healing, as well as legally in our state, therapists are not allowed to do that. They're pushing all this blood and fluid out of you and breaking tissue. Your body is going to reinflate, and it's going to reinflate hard, because your body doesn't know that it's not being attacked by a bear over and over and over every time you go to get those massages. The reason they tell you, oh, you got to come in every day in Miami right after your massages, you have to get all that stuff out, they only have you for a short amount of time. You're only in Miami for a little bit. They want you in there as much as possible. With us, I want you healed. I want you healthy. I want you whole. So I'm not going to tell you, yeah, oh my God, start 48 hours after every single day because it's beneficial. Get that stuff off of you. No, your body needs to heal. Your body needs to be okay. That's the point of these massages, right? Yes, we need to get the excess off, but we can do that through your entire recovery timeline. When it's appropriate, we'll either increase your sessions depending on where you're at starting from jump, or we're going to give you like a week. We're still going to do your massages to keep that stuff coming off, but maybe let's not be so intense right out of the gate because your body's still trying to get its bearings, and you do need that swelling to help heal, and you do need that swelling to help repair the body and get you your results so you don't wind up with crazier complications than fibrosis, which do exist. So when should we start? When we can start, when you're comfortable coming in, but more so when you feel like you're ready, right? So if you are ready 48 hours and you're like, yeah, I can tolerate being touched, as soon as possible is my answer. But that as possible part is going to depend on how much lipo you had done, how coherent you are, if you're off the painkillers, how you're feeling. So the overall answer for when do I start my massages after liposuction? First of all, you need to have the right massages, manual lymphatic drainage, gentle massages. That's what you need in your first 2 months is manual lymphatic drainage. Wait to do everything else. Second of all, as soon as possible, with the caveat of you need to be comfortable enough to get into the office. That is the biggest thing. You need to be healed enough to get to us. You need to be healed enough to have your skin moved and touch comfortably. Because even though it is gentle, we're still moving the skin. So making sure that you are really touching your skin and being like, okay, this is bearable. I'm going to go get my massages now. I'm going to start now. And then frequency is going to depend on where you're at as far as, again, that touch. How often and how much can we do without sending your nervous system into a spiral or without it exhausting you? Where are you at in your healing? So the next part of this article, which is kind of like an added bonus, I really do love this article. It is fantastic. Compression garments are a non-negotiable. Remember how I said that space, right, between the tissue and the muscle, or that new baseline of tissue where they took out all the fat, that's now a void that your body's filling with swelling because it thinks it needs to repair the hole. Compression garments do not get rid of swelling. If you are not getting your massages, your compression garment is only going to hold you. It's not going to move all that swelling out of that space. The absorbing and moving of swelling is the manual lymphatic drainage massage part. The compression garment is only going to squeeze that space closed. So a compression garment is a cast, basically, for you to heal in, right? So the compression garment is going to hold your skin and hold that tissue, one, giving it support so that you're not like feeling the inflation, first of all. Second of all, stop the inflation because that gap is closed so you can't swell anymore. And then it's going to help with healing of your skin and retraction. So bruising, swelling, and firmness are common between the first week and third weeks, says Dr. Neinstein. Although he adds that every recovery is individual, it's typical more if the patient is not very active in terms of moving around or not using compression garments. Remember I said lymphatic system needs skin movement? If you're not moving because you're in pain, because your garment's too big or too tight, either end of the Goldilocks spectrum there, where it's like squeezing you and you can't move, or it's too loose and you're feeling all that pressure and that pain. If you're not moving and walking and getting around, you're gonna have some problems. He advises his liposuction patients to wear a customized compression garment for 4 to 8 weeks. Caveat on that customized part. We're gonna talk about that. While patients whose procedure include athletic sculpting will also be given supplemental foam to place under the garment. It improves the squish and compression so we get better results faster. Let's talk about this. Supplemental foam to place under the garment. You guys, with the lipo foams, I love you all so much, but please, for the love of every god up in the universe, stop buying squishy lipofoam on Amazon. I have a whole video on lipofoam and what foam is supposed to be used after lipo. Not all foams are created equal. Not all foams are machine washable. Not all foams can be disinfected. Ew, gross. The difference in lipofoam, so there are a lot of foam out there, right? So as a decongestive therapist, we learn about gray foam, open cell foam. Kathleen Lisson has her Comprex that she loves, making foam chip bags, all those different things, right? We have a sheet, an 8x11 sheet of polyurethane foam. Okay, hold on. Let me grab my phone. This looks like all the other foam. It's yellow because of oxidization. You guys freak out about this. We're gonna go into foam a little bit. Oxidization is a process where oxygen touches something and it changes it to this. This is 2 years old, this foam, and it's just been sitting here for educational purposes. This is what they look like in the pack. They're crisp and white, okay? Your foam will turn color because of your garment, because of whatever you're using on your skin, because of oxidization. That's how I know you're using them. That's a good thing. But how do we know if they're clean? Well, we have an actual surgeon recommended medical detergent on our post-op shop website, as well as these foams, for you to medically wash and disinfect your foam and your compression garment. It's made for medical grade compression garments, so it's going to disinfect and take care of these so that even if they change color, you know they're clean. So there's that. Foam. A lot of surgeons will give you memory foam. It will feel like a Tempur-Pedic bed. How do you know? Hot tip. How do you know if your foam is doing what it's supposed to do in your garment, right? Because you will get lines on your skin from the foam. That is normal. You have swelling. That is normal. The same way you will get lines from a hairband on your wrist where you'll see the indents is what you're going to see on your stomach, even if you don't have fibrosis and it's just swelling. That is normal. That is okay. Soft, squishy lines are okay. Hard, thick, fibrotic lines are not okay. That's how you know your foam's not working. If you are having lines that you can pick up and move on your body like rods, if they're not soft and squishy, if they don't go away when you take your garment off and they stay imprinted on you, that's how you know your foam's not working. Because the point of the polyurethane foam, first of all, ours are medical grade. A lot of them aren't. But ours are medical grade polyurethane. This is the same foam they use after cancer in the lymphedema overnight garments. This is the same foam that they use to make the chip bags and products to help move fibrosis and proteins and swelling after cancer recovery for people that live with fibrosis their entire life. Yes, that is a thing. It's not exclusive to plastic surgery. This is the same exact type of foam. The memory foam that you guys get from online, from your surgeon in Miami, from all these different places, Contour something, I think Contour MD has a foam, but it's not polyurethane. And I've seen a lot of fibrosis happen because of that. The point of the foam, let's see if I can do this. The point of the foam is to sit on your skin, and when you move in the garment, do you see how my skin moves? Because the foam is sitting against me, and all I'm doing is holding it, guys. Look, I'm not putting any pressure. I'm just holding it, and I'm just moving the foam against my skin, and my skin is moving. Remember, manual lymphatic drainage is a skin-moving game, right, to get that absorption. So just by having the foam, and I have a pretty big gap here, just by having the foam on my skin and moving the foam against my skin, and again, I'm not putting pressure, it's moving my skin. It's pumping my lymphatics. It's mobilizing the proteins, and it's getting rid of fibrosis. Memory foam isn't going to do that because memory foam is going to collapse under the weight of your garment. So the point of your foam, like they said, supplemental foam to place under the garment, it goes under the garment mapping, and this is where you need me, mapping your lymphatic pathways, mapping these green lines, depending on where you had surgery. Tummy tuck, lipo, BBL, but we're talking about lipo. Depending on where you had lipo and where you're stagnant, I change your foams every session. So you guys can get the foams and put them in your garment. But if you're having trouble with fibrosis after lipo, or if you went to someone who was supposed to be doing lymphatic massage and they winded up just rubbing through you, and now you find this video and you're like, damn it, now I understand why it hurt, and then I have fibrosis now. Put these in your garment anyway and then set up a virtual. Get a pack of these. For Lipo 360, you need 2 packs. You need to be covered with foam 360. There are 3 foams in a pack. You're going to need 6. You need all the way around. In the video on the product page for the foams, I show you how to put these in your garment. That is for Lipo 360. If you just had lipo in certain areas, you can get 1 pack and target those areas. But because the lymphatic system works as one big unit, it's a system, I always suggest getting 2 packs, especially if we're dealing with fibrosis. It's always better to have more because we're probably going to use them all anyway. There's never been a case where I haven't used in 9 years all 6 foams for someone with lipo, even if it's just in targeted areas, because there's a lot we can do with these to help mobilize your lymphatic system. So supplemental foam, again guys, be very careful with the type of foam. It should not be collapsing or indenting or crushing into you under your garment. When I say indenting, I mean if you can feel the foam doubling over, the point of the foam is to help push the garment away from you so it doesn't collapse and give it a little structure, but then the garment pushes against the foam. And anytime you breathe, anytime you move, anytime you anything, the foams are giving you that gentle lymphatic stimulation. That's how they're designed to work. So you're going to be getting lymphatic stimulation, not direct manual lymphatic drainage where we're guiding those lymph pathways to reabsorb the swelling, but you'll be getting that stimulation. And if you're working with me, I'm going to be changing these at least once a week to continue guiding that fluid and stimulating those pathways in a certain way. So foams and garment, that's the thing. So around 3 weeks, it's typically a turning the corner moment, according to Dr. Neinstein, where the patient transitions from what did I do, I'm bruising, I'm swollen, to I can't believe I waited this long to do this. But without the compression, your tissue will take their time contracting and it will take longer to see visible results. Again, tissue contracting. I have a whole video on skin redraping after lipo, which is where the skin starts to tighten up and pull back, right? Because that skin is now adhering to the new layer of tissue. The foams help with that. So does your garment. If your garment is crushing you, it's not going to adhere flat. If your garment's too big, it's not going to adhere because your skin is still out here. If you don't have proper foams, that process of getting that swelling out and getting that skin to lay flat is not going to help. So not all foams are created equal. And then it talks about sticking to an anti-inflammatory diet, right? So adding that salt should be avoided at all costs, right? Because it will cause the body to soak up and retain water, which is true. It will also cause fibrosis. So avoiding eating out, right? Taking supplements that are anti-inflammatory, berries, pineapple, more plants. I don't suggest supplements. I won't. I will suggest using things topically like our post-op cream for fibrosis and swelling and bruising because your body's only going to absorb what it needs. Taking something topically, if you are also on other internally, if you're taking other medications as well as anesthesia or painkillers or anything like that, I don't like to mess with the body chemistry like that. That's also not my job and not in my purview. Topical is way better because one, your body's going to absorb what it needs, and two, it's going directly to the site of where it needs it. It's not traveling through your body then to be dispersed into your tissues. It's going directly on it. That's another video for a different day. But then it just talks about, don't use downtimes to start projects, don't hesitate to ask questions, and that's the end of the article. So basically, like, it says don't plan on using your recovery time to accomplish goals. You need to rest and recover, all that stuff. I truly love this article because it has everything that I'm saying to you guys in this video. But again, so let's wrap this up. After liposuction, when do we start our massages? First of all, what massages? Gentle manual lymphatic drainage. Wait till you are 3 to 6 months post-op to do all other kind of massage. It is not the time to do that. We need our massages, manual lymphatic drainage, to help absorb swelling, proteins that will cause fibrosis, and help that skin redrape and heal and close that tissue space so we get our results. That's why we need it. When do we start it? As soon as possible. What does that mean? As soon as you are comfortable with your skin being moved. How do we test that? The first time you go to shower, or any time you go to shower, every time you go to shower, place your hand on the skin of the surgery area. Do not push, do not rub, do not go in. Just place your hand and gently move your hand back and forth over your skin. If that is tolerable, then you are ready to come in for your massages. If that is not tolerable and it's too much, then you might want to wait a little while. You are okay to come in 48 hours after lipo. Again, with the caveat that you are healthy enough and strong enough to come in 48 hours after lipo. The frequency of our massages, how many do we need? That is also going to depend on how sensitive you are and how your healing is going. So if you are starting your massages 48 hours after, but your body is not that strong yet and you haven't healed as much yet, we may want to take it slower in the beginning and then pick up more frequent massages during the week, more frequent sessions, maybe 3 a week, 4 a week, as we get a little more healed and we can tolerate it. Or on the contrary, if your surgeon told you to wait and you've waited and now you're 6 weeks post-op with fibrosis and swelling, may we want to start those 4 sessions right out of the gate to get your system processing and debulk all of this stuff and decongest it, and then taper off at the end with 1 to 2 a week. So that's the frequency of it. But when can you start? As soon as you are comfortable, as soon as possible after lipo. Now, one last thing. That is also something, because I did mention it, that you need to speak to your surgeon about. But again, caveat to that. A lot of caveats in this video. Caveat to that. Surgeons don't always understand what lymphatic massage is. They think it's rough. They think it's aggressive. Unlike Dr. Subio, Dr. Wonderful Christian Subio, and Dr. Neinstein in this article, who say it is that gentle pressure. A lot of surgeons don't know that. A lot of surgeons don't understand it. They don't know how it works. They think, and they only think what they hear and what they see on Instagram. So they think it's fluid coming out of the body. They think it's rollers, it's machines, it's body contouring, it's all that. That's all other kinds of post-op massage. That's not manual lymphatic drainage. So when you are talking to your surgeon, right, and if you're going in for a follow-up or if you're going in pre-op, and I do pre-op consults as well. So if you guys need help with all this before surgery, call the office and schedule a virtual or an in-person session. And we'll get you jump started on all of this so that you can go into your surgeon's office and have all this knowledge and be like, hey, this is what it is. This is what I want to do. Am I cleared for this? But bottom line, you got to ask your surgeon when you can start your massages. If they say, oh, I want you to wait until you're a little more healed, ask them why. Ask them what they think lymphatic massage is, because the massages you need at that 6 to 8 week mark, that up to 3 months, is manual lymphatic drainage massage. And it's a gentle pumping motion. And it's done to absorb the proteins and the swelling so you pee them out. It is not rough or aggressive. It is not breaking tissue. It's doing the opposite. It's decongesting the tissue so it can heal. Your surgeon may think it's all kinds of craziness because they have no idea what it is. They just hear lymphatic massage is good and that's all they know. They don't know anything else. So make sure you're going in there and explaining to them it's gentle, it's not aggressive, there's no oils, it's not rubbing, it's a gentle skin moving, pumping motion that's not going deep, and it's gonna help with the swelling and, preventing fibrosis. So make sure that you guys are on the same page when you're talking about the word lymphatic massage, because a lot of times, like 90% of the times, when they tell you, oh no, just wait to do that, or take a painkiller before you go, or nah, it's gonna be too much, or nah, you don't really need it. If they say you don't really need it and it's up to you, guys, that is like gold star, green light, let's go. Okay, I've done the skin check. I can move the skin very, very, very gently. I can move it and I'm not in pain. It's a little sore, but it's not like, oh my God, I'm seeing stars. All right, I'm ready to start. I can start now. If that's 48 hours, cool. If that's 2 weeks, cool. That's fine. Now we have all the leeway to do what we want because your surgeon's neither here nor there about it. But if your surgeon says no, ask them why, because they may have a very valid reason, but they also may just not be educated enough to understand what it is that you're asking for. And then a lot of surgeons will say, like Dr. Neinstein and Dr. Subio, 48 hours after is great because we want to start decongesting the body while it's in that inflammation phase before it gets to phase 3 and 4. Proliferation, which is where those proteins, whatever proteins are in there, if it's a massive brick of swelling, whatever proteins are in there are going to start laying down and congealing and making tissue. And if we have massive amounts of swelling within that time frame, and that's like the 21 day, 28 day to about like your 6 week, 8 week mark, and then 6, or I'd say, yeah, somewhere around there, 3 to 6 months. And then after that is the remodeling phase, which is 12 months, sometimes a little earlier, to 24 months, which is where if we have fibrosis, our window is closing really, really quick. We need to get this out now. You need to start your massages now because now it's becoming permanent. So fibrosis and swelling, if you're still having all of that at 6 months, 8 months, we can still get that out of you before it becomes permanent because the phases of wound healing in that window. But a lot of surgeons will want you to wait until you're like, 4 weeks, like a month, 6 weeks in that range when your swelling and that inflammation stage has like peaked. But by then it's starting to thicken because we're getting into the proliferation phase of making tissue. So this is why we say 48 hours after. But that's going to be up to your surgeon. Like I said, as I just explained, they may have a very good reason. But they also may not be educated to know what's going on with the massages. So make sure you're telling them and having an open, honest conversation about it. Otherwise, yeah, as early as 48 hours after is when you can start. So that was a lot of information. I thought this was going to be a shorter video, but it wasn't. I'm so sorry. Okay, so the article is plasticsurgery.org/news/articles/8-ways-to-make-liposuction-recovery-a-breeze. And it's a great article. I would suggest you guys go read it. It's awesome. But if you guys need me, so let's say you had your massages, you still have fibrosis and swelling, go to Amare post-op shop. Link is in the bio. The easiest way to get these guys is on our Instagram and our link pop, on our TikTok too, on our link pop little button. We got the products right there. You can purchase them right from our link pop. Foams come in a 3-pack. If you had Lipo 360, not just your abdomen and your sides, you need 2 packs. You're going to place them in your garment. Watch the video on the product page. I explain how to put them in. You are also going to make sure that you're wearing your garment. And if you're having trouble with your garment, if you're having trouble with, and I have a video about this too, where this poor woman after chin lipo did carboxy, ultrasound, radio frequency, wood therapy, cupping, deep oil rubbing, and the lady was MLD certified doing the deep oil rubbing. Everything except incisional drainage because it was her chin and they weren't doing that. And came to me after all of that, like 2 months post-op, and we got it all gone because of the foams and manual lymphatic drainage. So if you guys have had all of that craziness and you're like, okay, now I don't know what the heck to do because I've tried literally all the things that I shouldn't have done, help. I have virtual sessions that I do where I can guide you guys and set up the protocol for reversing it and getting your results and pointing you in the right direction and getting you like on track to get all this stuff filtering out of your body, the swelling and the proteins and the lumps and bumps and fibrosis, to get to the results that are underneath and to get you back to healing rather than in this like stasis pattern of swelling and fibrosis. So virtual sessions, call the office 732-841-0142. My scheduling coordinator will be happy, as always, happy Alex, to set you up with a virtual with me so I can help you guys figure all this out. If you need to find a certified therapist, like I said, do not just go off of the fact that they have letters after their name and went to a certification course. Get the Vetting Your Therapist guide. It's $30. It's a PDF. It's got clickable links to all the schools that certify lymphatic drainage therapists, but more importantly, it's got those questions to ask them. Because just because they have the certification doesn't mean they're practicing properly or have the knowledge. So that is Amare Post-Op Academy. Link is in the bio. Link is also in the bio or description box and the bio on our Instagram. That thing is awesome. I love that thing. I have all my virtual clients get it. But that'll help you find a therapist, and that'll help you, especially after this video, be able to ask them the questions to make sure they're on the right track as far as doing the massage the correct way so that they know what they're doing anatomically and it works. If you are in New Jersey and you're looking for a therapist and you want my help, we are in Highland Park and Elizabeth, New Jersey. Call the office, set up an appointment with me, 732-841-0142. And guys, I think that's it. That fibrosis course I am working on putting together now. So it's going to basically be, what is fibrosis? How does it happen? Why does it happen? How do we get rid of it? The things you need to get rid of it, and how to do the things to get rid of it. So that'll be coming out in the next couple months. Keep a check on our channel, keep a check on our page, keep a check on our Instagram. We are in the process of putting together like a little button for you guys to, or a link for you guys to sign up for email alerts. So when we have new videos, you'll get an email, or when we have a new, mostly for the courses, we'll have that. I am going to do a video on our recent course that we just made because I realized I didn't do one. Which is post-op massage and finding a therapist. So it explains in depth, none of this content is on YouTube. It explains in depth all of the types of massage, what manual lymphatic drainage is, the science of how and why it works, why you swell so much after surgery, what you're doing that is making your swelling so bad after surgery, what you should be doing to reverse that. I go over the 4 phases of wound healing. I go over where fibrosis starts and how. I do talk a lot about fibrosis in that course already. It's just thrown in with everything. And then when to start your massages, what you should be looking for, what you shouldn't be looking for. It's like, if you like this video, that course is literally me holding your hand through the entire thing and deep diving on it. So that course is, and in there I go over the Vetting the Therapist guide with you. So you don't need to purchase the guide if you purchase the course. It's $150 and it's literally 10 times what this video is because YouTube won't let me post that much and that many videos or that long of a video. So we have the course and all of that is in there and you get lifetime access to it so you can always go back to it through your recovery, whether you're pre-op. It's really good for pre-op because you guys are deep diving on YouTube, but don't have a clear, direct line of information from a certified source. That's me. I gave you a clear, direct line, and it's the course. So check that out. The video for that will be coming out soon, where I go through like each module and explain what's in it and like how to use it and why it's valuable. For you guys, especially if you've gotten the wrong types of massages, this will undo all the damage. This course will help you undo all the damage from all the other fibrosis buildup and all of those things. So that is Amare Post-Op Academy. Link is in the bio on Instagram. Link is in the description box. And guys, I think that's it for this video. It was a lot longer than I intended. I am so sorry. But I will see you guys next week. Ashley with Amare. Bye.